Everyone, we have like just an hour, maybe a few minutes over, and I see more and more people are getting on for you to listen as Dr. Colletti and I discuss electrosclerotherapy 2.0, not 1.0.
Yeah.
And as we talk about the different applications for it, also this video will be stored on our VBF page and our YouTube channel. So after we're done today, you can go back and watch it as many times as you want. So today's session is all about a new treatment protocol. Now, sclerotherapy has been around for a long time, but electrosclerotherapy in the treatment of VBARS, vascular birthmarks, anomalies and related syndromes, has only been around about, what would you say, Dr. Colletti, maybe 5 or 6 years?
Yes, around.
Around 5 or 6 years. And from that original electrosclerotherapy, which was used for cancer, correct? It had been used for cancer.
Yeah.
From that has branched out even more precise types of electrosclerotherapy that are more amenable to vascular anomalies. And one of those, BEST was the first one, which was bleomycin electrosclerotherapy treatment. From that became the first modification, which is yours, correct?
Yes.
And that's called MEST.
Right. Yes.
For modified. What did you modify from the traditional BEST?
So let me tell you a long story short. I was, like many others, aware of the existence of electroporation as a device, and we're talking some 15 years ago. And I thought, well, we know bleomycin works in vascular malformations. So
It says that we ended, but let me see if it puts us, it's showing that we're live, but the video is not showing on here. I don't know if people, oh, now we're back. Okay. All right, because it went dark. Oh, thank you, Facebook, for messing things up. If you guys are watching, can you please send a message that you do see us and hear us? Because it's showing we're live, but then we lost video and now it's back. So just send us a note that you do see us. Okay. I mean, it's showing that we're live. So keep talking, Dr. Colletti, and some people.
yeah, I was saying I'm probably talking about 15 years ago when I knew that electroporation was used in combination with bleomycin to treat metastatic cancer for, those cases of patients who were not amenable to traditional surgery or other select cases. And I thought, well, but if this electroporation device works by letting bleomycin in the cells, thereby augmenting the power of the drug itself, why not try this in vascular anomalies? And at the time, I spoke to the representatives of the first machine that I used. And I told them that I had this project, but, at the time, I wasn't really a name, so they kind of dropped me. But since then, I persisted in this because I thought the principle must work. And so I started doing the first cases of electrosclerotherapy in vascular malformations. And like everybody else in the world, I was doing it to treat complex or refractory to treatment venous malformations or lymphatic ones. But nobody had tried electrosclerotherapy on arteriovenous malformations, high flow. Actually, there was a single case report, but it was anecdotal and somehow questionable. So I started my protocol and I started doing electrosclerotherapy in a conventional manner, but it didn't work for arteriovenous malformations. So I thought maybe we should change something, okay, which I did. And that something is that the injection of bleomycin, instead of being endovascular, is being done interstitially. So with the ultrasound, I check where the true disease is, and I inject there and only there the maximum amount of bleomycin. Then I do the electroporation in a very uh, like somehow obsessive way, because you really need not to leave any void when you're managing arteriovenous malformations, because uh, arteriovenous malformations are not simple vascular anomalies. They're kind of locally aggressive tumors. So you want to try and get rid of the beast, as you call them, in the
Monster.
or in the most thorough way possible. So I did the first cases, and we're talking 5 years ago. It worked. It worked beautifully. So then that became the standard of my practice for selected arteriovenous malformations. And then I published it, and I call this the modified electrosclerotherapy for various reasons that you can find in the original paper, which I made accessible to everyone. So if you go on the internet and look for Colletti G MEST, MEST, you can find the paper and read it yourself.
It's on the VBF
Good.
website as well.
Two, yes. And that was the first crucial step to me. Then what happened is I observed that although MEST done with the first machine, the clean imperator, which is the most widespread adopted one, had complications. And those complications were very intense pain, uh, the need to do it under general anesthesia, even for small lesions, because the electroporator from IGEA gives current in a way that the muscular contraction is very painful and very noticeable. So discomfort and pain is a limitation. Also, I had some cases of necrosis, and you have seen them, Linda. Some of them were pretty massive.
And
And
you're saying that's really because the device wasn't really sufficient to do the job. It was what you had at the time,
no,
but
no, it was sufficient, but so I then found out that there was this other company, it's called Mirai, who produced an evolution of the electrosclerotherapy machine, the original one. And the trick is that the current is being delivered by this e-pore, is called, in a totally different manner. They are not single pole pulses. It's a waveform
hmm,
delivery and a very high frequency. And this has several consequences. The first of all is that electrosclerotherapy 2.0, which is done with this machine, can be done under local anesthesia because it's not painful,
unbelievable.
and the muscular contracture
Unbelievable.
is minor.
What it's going to save families who have to go to Italy and get this done is unbelievable. So no
Yes,
hospital stay,
no
no
hospital
general
stay,
anesthesia.
except for kids,
Right,
because
but still, so for these adults who have had 50 procedures and
yeah,
they come in, they're gonna have this outpatient, so they won't have to stay overnight, no hospital. So it's gonna be much more reasonable for them. And what
yeah.
about and the pain? Talk
And
about
let
that.
me, yeah, absolutely. So the single most significant issue with electrosclerotherapy 1.0, the IGEA, let's call it, electrosclerotherapy, was unbearable pain. Some patients had unbearable pain. And I suspect the reason is because the current is being delivered in that way. Not
Right,
a single,
which
not,
means the nerves were affected and nerves are what make us feel pain. And you
Probably.
can't isolate them when you're going in, so there's no way to
Yeah.
prevent it.
Yeah. And I can tell you that since I switched to electrosclerotherapy 2.0, pain is not an issue anymore. It's just unbelievable. It's unbelievable. It's lighter. It's less painful. I haven't had cases of necrosis yet. Probably I will not have
Is
any.
this now, are you now still keeping this under the term MEST, but with a different device?
It depends. It depends. MEST is specifically conceived for complex vascular malformations, so arteriovenous malformations and widespread venous, complex lymphatic. Otherwise, when you only need to treat a mild form of a venous malformation, Lily's malformation, let's say, you can be more gentle. So it's a modified electrosclerotherapy, but more gentle.
So
Okay.
Lily did have the newer device,
Yes, she did.
and her recovery was remarkable, like
Yeah.
she's a normal child within days. So
Yes.
within 1 year.
Also, yeah, and that is a major advancement. Now I only do electrosclerotherapy with the new device. I don't use the other one anymore. But then there's another advancement that you have witnessed, and that is the needleless electrosclerotherapy, because that company produced a electrode that was conceived and approved for cancer, okay, gastrointestinal cancer, GI cancer, to treat colon and esophagus and the like. And this is an electrode that doesn't have any needle. It's two small plates in an electrode that can be used with an endoscope. And
Is
in
that
this,
what you use to guide it, is an endoscope?
yes, exactly.
Okay.
And that has allowed, I just submitted the paper today about the needleless
Oh, I
electrosclerotherapy.
can't wait.
Yeah. And that allows us to go inside any hole of our body, say the larynx, the throat, the nose, the soft palate, the nasal component. And again, the effectiveness of needleless electrosclerotherapy is amazing, amazing. You can get rid of malformations that were basically not manageable before, such as the ones in the larynx. But there's more, and you know it, because needleless electrosclerotherapy works so well that I started using it also on the surfaces, on the skin.
For Weinstein.
Yeah, for wine stains. I will do another one tomorrow. I
And
cannot
I want pictures.
you'll have them. I cannot tell you yet because one must be scientifically sound. So I cannot tell you what I think. Uh, but I think there's a bright future ahead of us for hypertrophic port wine
That's
stains.
what I was gonna say for the port wines with overgrowth, like
Also,
Kiana,
yeah. And you know what?
and like Eileen, and that have all that
And
over.
there's another big advantage of using needleless electrosclerotherapy in hypertrophic port wine stains. First, it's not surgery, and it can be done under local anesthesia.
Unbelievable.
Second, it can ameliorate the color, not just the size. Third, we are using bleomycin with electroporation. So there is a chance that with this technique, we will prevent regrowth.
And
You
remember what I
not
said to you, I think it's possibly acting as a genetic editor because you're going right into the mutation.
it may so to make a summary, I believe that electrosclerotherapy has done so much for our patients. And this new development, the electrosclerotherapy 2.0, the needleless electrosclerotherapy, are opening unthinkable windows of opportunities to treat difficult and complex and unanswered, unmet demands for our patients.
Have you, since our meeting in Philadelphia with ISFA, has there been any more follow-up about getting you to the US to do training?
We are working on it, and I will host several colleagues from the US to train them.
In
And
Italy? In Italy first?
in Italy, yes. And I will treat them straight away with the new device because, in my opinion, makes no sense to start with the old one. Again, imagine what it means to be able to manage under just local anesthesia, maybe sedation for the rifest one, venous malformation, lymphatic malformation that would otherwise need like dozens of conventional sclerotherapies or general anesthesia with the other machine, and the pain that you're pretty much aware of because you have followed some of the patients that I did, and you can witness that with that machine, pain was an issue.
Terrible.
It's not like that anymore.
We have a lot of questions, so let's try to get to some of them. Some of them are scheduled to see you and they're checking in to say, I don't know who this is, but their name is Gifted Memories. And she's watching from Ireland, and it's Shelley, Shellie, here. And I can't wait to head to Italy for my AVM, which is lovely to hear.
Yeah, I know who she is. Say
Yeah.
hello to her for me.
Yes, and Joanna Luis Rivera says, thank you, Dr. Colletti, for not giving up. And Caitlin
Never.
says, hello, Dr. Linda and Dr. Colletti. This is Caitlin Fisher. I've emailed you after our consultation last month. Can you respond with my question from our consultation? I don't really know what the question is.
I will go through my email. I think probably I will find their email.
Okay.
We'll do that.
So we have a ton more saying that are logging in and that are watching. Faith wants to know, can this be used on a 3-year-old with a capillary malformation that is symptomatic, swells, gets infected, has a temperature to it? So we know this is likely an AVM or a what they call a
Yeah,
CM.
maybe. Yes,
Don't let it, Faith, don't let
it
anybody
can be.
touch it. Sign up for the VBF Super Clinic in New York in October. Go to birthmark.org while we still have spots left, so you can get a free ultrasound and consultation with Dr. Colletti. But don't let anybody laser this 3-year-old until Dr. Colletti sees the child in New York. I don't know where you're from,
Absolutely correct.
but or if you're in Europe, you can see him in Milan. We do have a clinic in Bucharest, but we're actually closed out. We have so many patients from around the world coming to see Dr. Colletti. But Faith, please don't let anyone laser her until you see Dr. Colletti. Autumn is writing, hello from Kentucky. Our daughter is 13 months old, venous malformation of the left buttock, labia, and thigh. She's on sirolimus. 1 sclerotherapy because of bleeding. Could this procedure be performed on her since it isn't on her face?
Absolutely.
Risks and concerns, could it come back? If she were able to get this treatment, could she be taken off sirolimus, and can it be done on someone that's her age, which is 13?
So yes, it can be done any age. And yes, patients respond so well that they usually get off any drug that they were taking before. The position is not an issue. And as I told you, since I have introduced this needleless electrosclerotherapy, all the malformations on the mucosa, say the labia, respond so very well, and the complication rates are so low that you can expect like magic from
Wow.
the
So you
yeah.
mean the location doesn't matter?
No,
That's amazing. Absolutely amazing. And age doesn't matter.
doesn't.
Amazing. Andy is writing from Canada. My son is 8 years old with a glomovenous malformation. I haven't heard you talk about that yet, but I suspect it'll respond. It's located in his left cheek and roof and palate of his mouth. He started to experience pain. He also has two small ones on his right foot, one on his tummy. No treatment yet in Calgary. I asked about laser. They want to refer him to a clinic for laser. A new referral has been sent to Ottawa. How long does it take for the swelling to subside, meaning with any electrosclerotherapy? And what is the wait time to get in to have treatment done by you? So do you treat glomovenous?
I do, and they respond. They
But this one is pretty spread out over his body. So,
But even better, because conventional sclerotherapy is dose limited, right?
right.
So you only have that amount, and you have to administer it right there and only there. Okay. Whereas bleomycin, you can inject very small, very little doses of bleomycin and treat huge areas with electroporation. So not an issue.
So
Once
with the glomovenous, would you use MEST or NEST?
It depends. I need to see the
Okay,
case.
you have to see the imaging and see it. Okay.
Yes.
And the last part, I think I know the answer. You're booking out about 3 or 4 months now, or is it more?
No, it's 4 months.
4 months. So that's the wait time. I would suggest that if you are, first of all, the way to get a free consultation is to come to a VBF clinic because he's there. Outside of that, he does do virtual consultations, which obviously there's a fee for that, because it is like a regular doctor visit with him. But you can do that no matter where you're where you are in the world. And I know he has like, if your insurance doesn't cover it, he has a reasonable flat fee, for that, to cover that consultation. And then, go forward. But if you are thinking about this, the longer you wait, the farther out it's going to be to get an appointment with him. I really believe as a result of today's live that you're going to get so booked up that you're
Let
going to
me
be start
Linda, as you just said, I am already fully booked. Okay, so I'm not here for selling anything.
right.
I'm
I know.
just I really want to deliver the message that there is a chance for those malformations which were deemed incurable, to be managed so well and with so little side effects and complications with the new machine that I feel so very happy for our patients. That's all.
Well, I feel happy from when we met and we knew each of us that we were going to bring change, right? We knew it. And the next question is very good. I know the answer. So all the patients with Sturge-Weber that are watching this, you can address the stain, but you cannot address the glaucoma or the intracranial involvement,
No, unfortunately, no.
right? But you can address any overgrowth.
Absolutely.
So that's something. Okay. Caitlin, living with 39 years of a lymphatic malformation from New York. So Caitlin, you can see Dr. Colletti in New York City at our super clinic in October. Go to our website at birthmark.org and scroll down and you'll see the New York City clinic registrations open. Before we get filled up, I would suggest you make a registration and you will get an appointment with him. Kinley's venous malformation story. Hi, Dr. Clay. Kinley is
I
8 and we are from Utah. She has a
I
venous.
know who Kinley is.
Oh, okay.
I know.
But she says it used to be high flow as it was connected to her heart and lungs, as well as a couple spots on her jugular. Those connections were severed a few years ago and now receive bleo every few months. We're excited to meet you in October. What would the recovery time look like after a mest? Also, is there an optimal pulse width modulation to balance opening of the cells and any sort of burning or cauterization?
Yeah, that is a good question, actually. And that is the what I was talking about earlier. So how the electrical current is being delivered. Okay, so the new machine has a higher frequency and biphasic delivery that makes everything more tolerable, reduces side effects while maintaining the same efficacy. That's the point.
Awesome. So
But mind you, there is a total dose of bleomycin that one should not go beyond. Okay,
right,
so
there's a lifetime limit.
yes, if you are receiving so many sessions of bleomycin, just try not to do too many so that you may not be able to receive electrosclerotherapy after.
That's right. And is it a based on weight? Is that what it is, based on your weight, or is there
It's,
just a generic number that's a lifetime
it's,
for
it's
everybody?
partially based on weight, but there is also a suggested lifetime total dose that should not be um, reached.
So with the old sclerotherapy and people using the Bleo, about how many standard treatments would you be able to safely get before maximum? Is it about 20, 30?
With conventional sclerotherapy. If I got your question right, you mean how many treatment would you need before you get to the point where you say that is the good result? Is that the
No, no,
question?
no, before you reach maximum dose and can no
Depends.
longer.
It depends. It depends. It's totally dependent on how much bleomycin is being administered every single
Okay.
time.
Just because some of the people are saying they've had 20 or 30, and I don't know if that means they're at the max and they won't qualify, or they may, you'd have to go back and look at all the records and calculate.
I I hope nobody gets angry at me because of what I will say, but if I had a vascular malformation that was treated with bleomycin alone now, I would suspend the treatment to be 100% sure that I can receive electrosclerotherapy.
So I hear you loud and clear that anybody who's going for these repeat bleo every month or two, like they all are, you saw a patient in Philly with me that little boy had, I forgot, I think it was 8 sessions
It was
with
more.
with the
It was more.
nostril, 8 or 20 or something
20.
like
It was 20.
20, and he's like 3 years old. So,
Yes,
but thankfully, he does qualify for
it
your
does.
your treatments, and we'll be going to Italy to get them. But that was pretty aggressive, pretty aggressive. So I'm just trying to see the questions. There were some more questions, and now I'm a little jammed up here.
Mind you, I'm not criticizing the colleagues who are trying their best to help patients. I'm saying that this new development is making possible results that were not conceivable before, you know. And with this new advancement, the electrosclerotherapy 2.0, with a tolerability that is so high that I suspect it will become the new standard.
Taylor Wagner says she can't wait to see you in September. And Taylor, I can't wait for your outcome. I've been following you, girl, for years and wanting you to see Dr. Colletti. I was so happy when you saw us at our super clinic because I never forgot about your journey. And I'm so happy for you. Very, very happy. And I need you to email me right after your procedure. Adrian from Peru is writing, the patient is 4 years old. He has an AVM in the glabella area or between the eyebrows, which is marked when pressure is exerted or with cold temperatures. One, what is the ideal age for treating? Wait a minute, he's saying AVM, but I think this might be a physician, so just bear with me. Consultation from Peru. Patient is 4 years old. He has an AVM in the glabella area between the eyebrows, which is marked when pressure is exerted or cold. Number one, what is the ideal age for treating a venous malformation of the nose? All right, so let's take these one at a time. So the first one is the 4-year-old who has an AVM between the glabella. You can treat that now.
Yes, but we need to go back to another very important concept, okay? The gold standard in terms of cure rate for arteriovenous malformations is still surgery. So if an arteriovenous malformation is surgically resectable, and this will not cause any damage, either aesthetical or functional, then surgery is the best option. I developed modified electrosclerotherapy and all the new advancements to manage those arteriovenous malformations where surgery is still feasible, but the price to pay would be disfigurement or severe functional, uh, disabilities. So this is why I conceived and introduced and published this technique. So say it's in the AVM, most likely an AVM in the glabella can be resected by an experienced surgeon without leaving any or very small marks. So that's what I would do.
So
The
Adrian,
patient,
so Kiana, I know you're on, so please post Dr. Colletti's email for Adrian to send him and consult with him regarding that case, which is, and again, what you really are talking about is your staging system. So
correct,
based on your staging system, this is a SCG1 or any of those that are amenable, but once it gets in, and that was when you and I met, when you were presenting the staging system, and what you really have done is you crossed the bridge to the ones that were no longer treatable and gave them a treatment option. So
correct.
you still
It's
stay with the
exactly what it was and what it is.
I know
Exactly.
you stayed with the SEG staging system, and that's still intact, and that's
Yes,
the
because
and that's
S1 and S2 still have to be managed surgically.
right. So that's still the gold standard, but
So
now you've added the ones that were no longer treatable and
that,
gave them a treatment, or the ones that the people have had 30, 40 surgeries, they just keep coming back and
yes,
they are disfiguring. So
yes.
very good that we got that sorted out. Now, the second case is, what is the ideal age for treating a venous malformation of the nose in a child? Is there any advantage to treating before age 7?
Absolutely. I am pretty um, like strong on my statements about this because you need to understand that we need to understand that it is not just a matter of health, which is, it's also a matter of psychosocial consequences. So you leave a baby, a kid, with a malformation that is evident, visible, obvious, and his or her peers will notice it, will point fingers at it, and with all the consequences you can imagine. So, and also you have to understand that the smaller the malformation, the easier it is to treat it. So I usually don't wait that long.
So a
I
venous malformation on the nose of a 4-year-old can't be bigger than this because the nose of a 4-year-old's like a little button. So you're
exactly.
saying, let's get it done now, especially before they hit puberty.
Oh, absolutely. But even way before that,
Right.
I recommend all parents not to wait beyond the age of 4
As a matter
because
of fact, I mean, isn't it ideal upon diagnosis and confirmation of the diagnosis?
yeah,
Yeah. So, I mean, but don't go any later than 4. So
no,
prior to that, it's easier, just like Dr. Geronimus says, It's easier to laser a head this big of a newborn and get clearance than it is of a big adult head. So you're saying the same thing. This
Oh,
venous
yeah.
malformation is this big. Let's take care of it when it's this big before it gets to be this big.
Especially because we're talking one and done, you know,
One and
in the
done.
vast majority of cases. We're not talking 10, 12, 20 treatments. We're saying one, maximum two.
So he has another question, which I know the answer to. He says, are there any programs, foundations, grants, associations that help with international families for treatment or financial? We know of none. We have 2 full-time people and we've already helped nearly 200,000 and less than, well, actually it's close to 1% donate back to us. So most of the people that are doing these treatments from around the world are doing GoFundMe's, but also now that you're introducing outpatient, that's going to cut the cost down from, I'm just going to guess. So say someone that had to pay 30,000
It's now
will
going
now
to
be
15 or 18.
15 or 18. That's exactly what I was going to say. That's amazing.
Yes.
Amazing. Amazing. So then would you recommend, this is a good one. I know the answer is going to be yes. Would you recommend an updated MRI before making treatment decisions for a child whose last MRI was performed at 13 months and now is 4 years old?
Absolutely.
Because they change.
Absolutely.
Yes. So
We
again,
need that.
Adrian, please feel free to email Dr. Colletti. His email will be down in the discussion. Allie, hi Allie. Allie, is it possible for future treatment of CM complicated by recurrent pyogenic granulomas due to BRAF mutation? I know this, Walker is one of my favorites. So we saw him at the VBF. He's now on Treneptibit,
Yeah. If you remember, Linda, they presented his case at ISPA.
right, and he came to our clinic. Yeah.
Yeah. So
Um,
he would be a very good candidate for NEST.
for Nest, and then he'd be able to come off this because, like she's saying, it's our only option, lifetime oral meds.
No, I will not take that as an answer.
So you're saying he would,
I will work and we will be able to offer an alternative
so
treatment.
would he would be messed, correct?
It will be NEST,
Nest. Oh, okay. So he would be the
but it's
needle.
superficial. Yes.
Wow. Oh, that's right, because it's superficial. That's phenomenal. I think I need to get you to put like 6 cases together in one day and I have to come and see. We've
Yeah.
been talking about that anyways. Well, there's no volunteering, Michaela. You can go and get a consult and then he'll give you the estimate or the quote and then you arrange to go to Italy. Thankfully, he's going to begin treating doctors to do this, and there'll be more possible options for people in the near future. How soon will they be going to Italy this year?
Yeah.
This
Yeah.
year. Right, well, that's awesome. And as soon as we get those names, VBF will make everyone aware of who they are. Jenna says, we're from New York, York, Pennsylvania, and my daughter's 2. She has a port wine. She's had 16 laser. They told us we reached maximum clearance, which is 70%. It seems to be getting worse, hoping for better options. I would recommend you come to our super clinic and see Dr. Geronimus. And I'll
Absolutely.
tell you why. He is getting clearance for lesions that have not been getting clearance with a combination of a brand new device called the Aveva, which has like radio frequency. It has all kinds of medical devices within one, and the pulse dye together. So lesions that were just resistant or reached maximum, he's really breaking through with those. He presented at the ASLMS. I saw the results. It was phenomenal. So Jenna, sign up for our super clinic in October. I will assign you personally to be in with Dr. Geronimus. Will be using the Pro along with the Aviva. So go to birthmark.org. You'll see the New York clinic sign up. There's no clinical trials for this. What's happening is when the doctors get treated, they will just begin treating, and you will reach out to wherever those places are, and they'll check with your insurance. And once you're in the US and these doctors are trained, pretty much your insurance, if you have good insurance, will have to cover it because it's likely not offered in your state. And if you're lucky enough to be in the state where one of these new people that's being treated is going to be, then you're even hit the jackpot. But if it's out of state, they're supposed to cover it. So yeah, so it's not like clinical trials that people can sign up. Is Canada being trained in this? Not yet. I wrote to the head of their new Vascular Anomalies Alliance of Canada, and asked him to invite Dr. Colletti to present this in Canada, but they never responded back. My grandfather is Canadian, was born in Canada, and I'm in upstate New York, very close. And there's just been this resistance that we've lived with for 32 years, which I don't understand. I would think we do have some doctors from Canada actually come to our super clinic every year. Dr. Colletti knows them, some experts. I just wish they would be more proactive, that's all. Because I don't believe in people having to travel from Canada to New York to get treatment when they should be able to get it in their own country. And that means any country, in my opinion. Hello from Indiana. I wish MEST was available for my granddaughter. Well, one day, Jenny, it will be, and maybe soon. Whoever gets trained by Dr. Colletti, we will know who they are and put them on our website. Hello from Kentucky. Our daughter is 13 months old. Venous malformation of the left butt cheek, labia, and thigh. On sirolimus, 1 sclerotherapy for bleeding. Could this be performed on her since it's not on her face? You already said yes, anywhere it can be done. Risks and concerns, could it come back? If she were able to get this treatment, could she be taken off of sirolimus, which you already had a question like that, but go ahead and can it be done at her age, which you answered all ages. So she's 13 months with a venous malformation in the left buttock, labia, and thigh. And she's on
Yeah,
sirolimus.
yeah, absolutely.
So he had answered that before, but the answers are yes, 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 and yes. She is a candidate. He can treat her. And yes, she will be able to come over the sirolimus. Now, the recurring question can't be answered yet. I mean, you're looking at follow-up imaging and you're saying no evidence, correct? No evidence.
No, but one really needs to be scientifically honest.
Right.
And being scientifically honest, I don't know the long-term efficacy because some malformations will come back after 8 years, and we don't have an 8 years of follow-up yet.
Right. So we don't know.
What I can tell you though, is that the effectiveness of this technique is superior to any other thing that I have done in my 20 plus years
Well,
of,
and let me ask you a question, because the venous malformation mutation, is that tied to?
yeah.
So, can we not do like somebody like Lily or someone who's had a venous malformation? And can we not test them by blood and see if they still carry the mutation or if it's gone?
No. Well, technically, yes, because you can do something called digital droplet PCR. So you can test if there is some malformation still in the bloodstream, but it is a very expensive test that I doubt it will be done just for, checking.
Right. But you're doing ultrasounds and you're seeing nothing.
No,
And also for the ones that we did with the AVM study, you were getting MRIs and you're seeing nothing.
absolutely. No, no.
So that's very hopeful. Oh, Maura, I know Maura's journey. Hello from Alabama. Hi, Maura. Nora is 3 years old and has a mixed lymphatic malformation on her right cheek, jaw, airway. She's had multiple sclerotherapies. I have a copy of her most recent MRI on DVD. Will that be sufficient to bring to the clinic October to see if she would be a candidate for MEST?
Yeah.
Or what format does it need to be? She can bring it. I mean,
The CD will be okay.
as long as you have a laptop or somebody does that can receive it. Mine doesn't.
I always bring it.
Okay, perfect, perfect. The next one is your patient, Alicia from Florida, Alicia
Oh,
Marie.
hi, Alicia.
Do you remember if you used my AVM, the new machine or the old machine?
What's the old one?
Oh, the old one. Okay. She said, I have had a bleed twice from the ear, but not from the scalp. I still have the bump. Is Dr. Levitin going to be trained by you? I will go to the conference in October.
Yes, of course. As soon as we're ready, Dr. Levitin will be one of the first to have the machine and do the procedures.
Okay, thank you for that. Emily Elder. Hi, Dr. Colletti.
Hi,
Prior,
Emily.
prior
Long time
to
no see.
prior to EST or AVM remission, I was told to be wary of pregnancy and any hormone changes as we are worried about my AVM growth. Is that still a concern post EST?
Emily, do your homework and get that baby.
I'll babysit for you, Emily. You're in my neighborhood, so not too far. Auntie Linda will babysit for you. But basically, anybody who has nest, mest, or best, well, we'll say mest or nest.
Yes.
They should be safe. They're no
Yeah.
longer concerned about
Emily,
hormone
Emily can do
fears.
whatever she wants. Yes.
Great, phenomenal, phenomenal, phenomenal. And now from Karen, we live in England and are very interested in learning more about MEST for our daughter. Hannah is 14, has a lymphovenous malformation affecting her left hand, extending up to her wrist. It affects her ring finger and little finger, causing pain since the age of 7. She underwent sclerotherapy. It was not successful. Her surgeon removed some lesions in an effort to reduce pain. I have a couple of questions based on the info. Would MEST be suitable for her hand? Or is MEST likely
So,
to be?
okay. Bleomycin electrosclerotherapy, the conventional one with the old machine, has been used for cases like this one. Okay. And probably it's effective. The thing is that on fingers or arms, there is an issue with the old machine, and it's that the needles of the old machine are very thin, so they bend.
Which old machine? Are you talking the IGEA machine?
The idea, yes.
Okay, okay.
The new one has
1.0, 1.0, the 1.0, which you're no longer using. You
no,
will not use that machine again, correct?
no.
Okay.
Uh, where it would be absurd for me to use it. I mean, for all the things we said, and I've already told you about this over and over in the last few months, I think. They bend and they can converge the needles. This is the cause, supposedly so, for a few reports of electrosclerotherapy causing permanent damage to crucial nerves. Okay,
Makes sense.
so if I had to decide, I would not do conventional best on fingers or hand, whereas I would very confidently do needleless electrosclerotherapy because
Because
that
then you would avoid the risk of damaging those fragile
would be
nerves,
zero risk.
especially in the extremities, which are so.
Yes.
Excellent. Okay, so Meg says, I have an AVM left face. Oh, sorry. Sorry about this. I have an AVM left face, neck, tongue, eye. I'm 61 from Connecticut. I had my carotid artery ligated at Columbia when Dr. Berenstein was there. And 6 years, six something with Dr. Nasseri. The only thing I can tell you, Meg, because I don't know what your question is, and you got some mixed up stuff in here. I don't know what that reanastomosis of artery means. But come to the super clinic in October in New York if you want to meet Dr. Colletti and have,
Or you can start sending me your most recent imaging.
yeah, or if you have recent imaging, you could send it to him. We've posted his email in this discussion chat, which will remain. And you can sign up to come to our clinic in New York and see him in person. Okay. Okay, we're thankful for you. People saying, oh, Harper, who you're going to see in November. We don't know. Well, first of all, she wants to know when it'll be available in the US. Well, first of all, having 5 doctors trained means nothing because the device is not approved yet to be used in the United States. The FDA has to approve the treatment, not just the device. So first is the device, then the treatment. Now, for the treatment to be approved, they will have to set up a very, very strict
Trial protocol, yes,
a trial.
everything. But we think that the process of having everything set up will take 1.5 to 2 years.
Okay, that's what I'm saying, around 2028.
Yes, probably.
And we'll know. We'll be, as soon as anybody's trained, you'll see it on
Yes.
the VBF website. Arthur said, Dr. Clay performed surgery on my wife that no one else could do. Now we're ready for the next one. She has waited for this her whole life. Arthur Spolnick.
Oh,
Hey,
I
they're,
love him. Zanita. Hi. Can't
hi,
wait to do the next surgery. That one will be game changing.
oh, so Heidi, hi Heidi. I was just Heidi Hess. I was just looking at your son's picture the other day. I'm hoping he's doing great. So if they go to Italy for treatment, my son's 21. He has the overgrowth. You've seen him at our clinics, I believe. Yeah, he saw you in October 2 years ago. That's right. I remembered he was there. So how long, so he's got the overgrowth, okay,
Yep.
like this area.
Yeah.
How long? So they arrive on Thursday, you're gonna do nest on Friday, I'm just pretending.
Yes, and it's going to be an
Out,
outpatient procedure. Yeah.
and then he could go home Sunday, Monday.
Yeah, Monday. Yeah.
So there you go. That's how easy it is. Okay. I'm from Ontario. I am 45, port wine. I've had laser treatments with Dr. Wayner. I stopped because I would develop multiple open wounds on my face
With laser?
for, yeah, multiple open wounds following laser treatments,
That's very strange.
unless it's not a pure port wine.
Probably.
So I would suggest you try to come to our super clinic, Jilly, in October and get an ultrasound. Make sure that we're really talking about a port wine, because remember, they call them CM AVMs, and I hate it because they're really AVMs. But we looked at how many stains, how many CM stains, and every one of them illuminated as an AVM, correct? Even the ones
Okay.
this big showed up as AVMs, stains. So if you have the CM AVM in the family and you put an ultrasound on that stain, it's not showing up capillary, it's showing up arterial.
Yeah.
So I would come to the super clinic, or you will all have his email. And you can also put, well, probably be better if we did, but I can't remember it. Is it info at Studio Colletti?
No, just give
Send
them
it
my
to you.
email. I
And
will
then,
then
okay, so
forward.
just
Yeah.
send it to, you can email directly to Dr. Colletti. It's there. He'll forward it to his assistant and she'll reach out to you. But we do have the clinic in October where you can get the ultrasound and he can outline with all of you which one it would be, nest or mest, when you could possibly get it done, how many he thinks you might need. Quite a few of these are done in one. Some do require two, but maybe even some really, really monsters, maybe three. But I would say probably 80% are one. And then maybe 15,
85.
okay, are one. And then another 10% two, and then the rest would be three. And have you had to do more than three on anyone?
Not yet. No,
Not
they don't
yet.
have.
Okay.
No.
We are gonna go over a little because I want to get these important questions in. Autumn says, my daughter has it in the same spot. Oh, she wants to connect, okay. Emily says, our family is excited about this for our 19-year-old daughter. Okay. Magdalena, I have Bean syndrome, double TEK mutation after 3 scleros with bleo, with not so great an effect. My VMs are everywhere, all part of my body, mostly face, neck, larynx, also GI, and she's 51.
Yeah, perfect for this technique.
Nest.
Nest.
Yes. That I want to see because that's multifocal.
Yeah.
So you just move around from one area to the other. Amazing. You know I love this.
I do.
Okay, so Tracy, I'm in Texas. I'm 64, VM in my right arm and hand. She had sclero with Dr. Rosen and once in Texas at UT Southwestern. I wear a compression sleeve and take Xarelto to manage pain. Can your procedures help? So
Yes.
yes, they can.
Send your imaging.
Yeah, so again, you'll see his email here, and which is giacomo.colletti@gmail.com, but it's, I believe Kiana posted it. And you can write to him directly and he'll need to look at your imaging. Okay, so you're waiting for MRIs. So Autumn wants to know for the virtuals where it's not insurance is covered, are you doing the flat VBF?
Linda, I just do what they tell me to do. So they need to speak to Julia.
Your assistant, so whatever the hospital tells you is what it is. But it's very reasonable. I know it's reasonable. How many, well, we're scheduling every day. It's not a matter of how many consultations he has left. So he's doing ultrasounds on 2 different days, Friday and Saturday. So you just have to sign up, and then everybody who signs up gets a slot until we're full. We just had to close down Bucharest because he was completely booked. But that's only 3 weeks away. For New York, we're a couple months out and he has spots left. Okay, I have insurance from Poland. Will it be accepted in Italy?
Yes,
Well,
absolutely.
good. That's good news. And you're working with a really nice doctor from Poland too.
He's great. Not nice. He's great.
Oh,
Dr.
yeah, I liked him. What was his name?
Jacek Banaszewski in
Okay.
Poznan.
Very, very nice. So Denwani Phrygian, my son is 9 with a 9, I don't know if he means 9 months or 9 years, but multilobulated veno-lymphatic that's affecting him, severe pain on his left forearm, losing strength and improvement, attached to his ulna, multiple nerves, taking over his muscle. He has had multiple rounds of bleo the last 6 months with no improvement, just tried cryoablation that did relieve some pain. It gave relief, no pain for 6 weeks, going for another. If bleo hasn't worked yet, every 4 weeks, do you think it would work using electro? Do you think
Yes,
doctors here in the US?
most likely. I also have a new protocol of another drug added to bleomycin. I told you about that, Linda, we just cannot speak about it because
It's
you
your
know,
it's proprietary, yeah.
it's not proprietary, yes. And
So yeah,
that helps when bleomycin alone is not sufficient, that drug enhances the effectiveness of bleomycin alone on tissues in general and vascular malformations, lymphatic malformations in detail.
okay, so Denoni, we already spoke about this. You can go back and listen to it in more detail, but I can just tell you that there is no one in the US currently licensed or approved by the FDA to do this. The machine's not approved in the US. He is going to begin training some doctors from the US in Italy, but then they'll have to come back, get the device accepted by the FDA, and then do some clinical trials. So we're thinking maybe 28. You also weren't on in the beginning where he said if you're nearing maximum bleomycin allowance for the
Oh,
life of the patient, then you really need to not get any more sclerotherapies until you can, whether you go to Italy or you wait until it's approved here and can be done here, save those precious allowances with Bleo, because what you don't want is to not be able to get it because you've already reached the maximum dose. That would
exactly.
be that would be like a horrible. So be very mindful, all of you, of what that maximum lifetime dosage is for you or your loved one. Keep track of where you are with it. And if you are nearing even 75%, hold off, because he has to use Bleo in this treatment as well.
Yeah.
So, and even though it is directed directly into the malformation and not distributed around it, it's still a concentration that still counts towards your maximum life allowance. Jasmine says, my husband has AVM that's on the right side of his chest, both front and back to his elbow. Would ES be an option for him?
Absolutely, yes.
And again, I keep repeating this, but I see new people jumping on every minute. Super Clinic, October, VBF, New York City. The only time you'll get a free consult with Dr. Colletti, sign up at birthmark.org. He'll be
May I,
doing.
Linda, ask one thing to whoever is listening to us? Uh, this is my request, my personal request. What VBF is doing for all these patients is it's amazing, okay? And it's doing all of this because it has the budget to spend for lodging, for renting the facilities and everything. So without your support, your patients and parents, VBF is not going to be able to do this for much longer. So please, any one of you, it doesn't matter if it's just a little or very much, depends on you, but please do a donation to the Vascular Birthmark Foundation, because everything you're hearing now and you're witnessing was possible because of VBF.
Thank you for that, Dr. Colletti. So it's birthmark.org/donate. And as he said, I could tell you stories of taking cuts in my salary so we can still give free lodging to people. And that is because only 1% of the people we've networked into treatment donate back to VBF. So everybody who comes to our super clinics and gets a free ultrasound, we don't say you have to make a donation to VBF. We don't say you have to give. We'll send you a follow-up letter, ask you how your experience was, and then say, if you would like, please give. But we only get 1% that give, and there's nothing we can do about that.
I mean, uh, if you do that, you make this available to so many others. So
That's right.
it's
When you donate, you're paying for the family next year that needs to come and see Dr. Colletti. That's paying it forward. So if you donate today, there'll be family next year. Like if
mind you, we are not being paid.
right,
We are
right,
not being paid.
right.
Not me or Linda, not
Right,
anyone.
right. You come as a volunteer. Um, Lacey saying you diagnosed Harrison's nose and forehead AVM 2 years ago. I remember Harrison. His genetic test came back with no findings. Should we push to have a biopsy?
I actually don't remember the specifics.
The
But
one that I think Dr. Comey brought us in, and it was the nose and the forehead.
yeah,
Remember?
so it most likely will need a biopsy because most of the time this is not a germline mutation, it's a somatic mutation, so it will not be detectable in the general bloodstream except with very specific and ultra expensive techniques. So you're going to need a small biopsy, yes.
Yes, and Andy, yes, I have said it repeatedly. People come to our super clinic. Last year we had them from 27 states and 18 countries. We are open to anyone. We don't care about wars. I mean, Dr. Colletti and I had a clinic in Italy. In one room, we had a family from Russia. In the other room, we had a family from Ukraine. Right, Dr. Colletti?
Absolutely.
The patients don't care about wars. They don't care about race, religion, socioeconomic status. We treat every single VBARS patient exactly the same. And you're more than welcome to come to our clinic, but you have to sign up because, you know, the slots will be going. It is in October 9th and 10th, Columbus weekend, New York City at the New York Laser and Skin Surgery Center. We have all kinds of services, ultrasound, glaucoma check, Sturge-Weber check, free lodging, psychotherapy, bedazzling, book reading, dental, a full dental clinic. So sign up. Um,
A whole lot of do-gooders.
a lot of do-gooders, exactly. Um, okay, we already saw that on the consultation from uh, Julia Dominin. Hi, Dr. Colletti. It was a great pleasure meeting you. I did the mess 6 months ago and I am still a bit swollen. Will it go away?
Uh, what's her name?
Julia, the same as your Julia spelling, Dominin, Dominin. And she had messed with you 6 months ago.
Julia, please send me your pictures and I will respond to you.
No, Shannon, Barbara Humphreys will not be trained in this. She is a
Unfortunately,
Yeah, she's a nurse. No, that's not even possible, but sad, but true. Jasmine, my husband's 35. We live in Oklahoma. He's been having treatments his whole life, but relief is short-lived. I don't know what he has, but you're free to come to our super clinic in October and meet Dr. Colletti. Oh, back again to Autumn. Would we see substantial decrease in size and the malformation from one treatment on the leg, labia, and butt on that
yeah,
case?
absolutely.
Okay. So we're getting down to the finish line, people. We only got a few more minutes. Oh, so right here, they're like, we are 85%. So we have discontinued Bleo at this point. Good. Save
Yeah,
that 15%. I wonder what that, I mean, I guess I would like the math. You know me, I want to know if he's got 15% left, how much do you need per treatment?
depends.
I know. I wish
Very-
I could do I wish we could do the math. Um, no, there's the new laser is not in Italy yet. It's not even in Europe. The probe
Oh,
is not
no.
even in
All right.
Europe. No, not even in Europe yet. We met Dr. Colletti through our video. Whitney Antley, our daughter is 4 years old from Louisiana with VLM around behind her eye. We can't wait to schedule her appointment.
Yeah,
And
I will do nest on her.
oh, you're going to
I
do
will do
nest.
nest. Yes, I
Wonderful.
already did that in a few patients, and the results are excellent. And I can tell you that needleless electrosclerotherapy can also be done at 1 millimeter to the optic nerve, and it doesn't damage it. So
That's
again,
amazing.
yes, it's
Amazing.
absolutely
I have
game
to see
changing.
this. I really have to see it. Dory wants to know if the lymphatic malformation can be cured for her 21-month-old who has the LM in the floor of mouth and tongue. He's on sirolimus, 2 rounds of sclero. This
I
sounds perfect.
Yes, absolutely, but I need to see the imaging.
Okay, so Dory, you can either sign up for our clinic in New York, which is free, and get the free ultrasound and the free consultation and the free lodging. But again, they will run out. The appointments will run out and the lodging, and then you can see him in person, or you can set up a virtual consult. And his email is in the dialogue box here. It's been posted. Sure, there it is. I see it right there, his email. So, okay. That again, we don't know, but Autumn wants to know if you treat a VM and they're before puberty, when they go into puberty, will it come back?
Well, there is the risk is there, but you don't have to imagine that it will go back to where it was. You can have small relapses, okay? But when you do a treatment that is this effective, relapses are unlikely, and even in the case they take place, they are minor.
So we already know hormones do affect vascular malformations,
They
and
do.
that just keeps happening. We know that. We know that. We've all known that. We've known that for 30 some years.
Yeah, but again, the smallest you were able to make a malformation before puberty, the least concern it will be. If you leave it untreated and then puberty comes, things can get pretty messy. So I usually advise to treat before puberty.
Awesome. And Amberlynn, I'm going to answer quickly because Dr. Colletti already answered that he can treat glomovenous malformations successfully. And you're in Philly, or he's being seen in Philly. We have the super clinic in October in New York City. Dr. Colletti will be there doing free ultrasound. So I would highly recommend you sign up. Right. Okay, so you'll get somebody's just saying they're getting their, Shannon wants to know, she's 54 with large facial port wine and wants to know why her doctor ordered an MRA.
Probably they want to take a look at her brain, I suppose. Otherwise, if it's just for the skin component, I cannot answer.
Right. Amanda Moore, Dr. Clay did address this earlier, that the MEST works on extremity AVMs.
Yes, it does.
So, and Ash says, at 29-year-old Ashton with a VM of the tongue, masseter, epiglottis, roof of mouth, lip, head causing headaches, assurance is not helping. PCP is at a loss. Where do I go from here? If you come to our clinic in New York, you'll get a consultation with Dr. Colletti. He already mentioned, if you haven't been on, that he's training some doctors from New York, but it's going to be a couple years that we've got to go into clinical trials. We've got to get the device approved, but you could go now to Italy, and you could also come to New York and at least have him see him. But from everything he said, he definitely can help your son. Definitely
Absolutely.
can help him.
Absolutely.
It'll be on our website, Jasmine, when Dr. Colletti is done training. The doctors from the US that will be learning this will have to work with VBF, because the FDA will require a patient advocacy support group, and every doctor trained by Dr. Colletti is required to work with VBF. Right, Dr. Colletti?
Yeah, it's like
So,
that.
yep. Will this work for Joanna? Said her question got lost. 7-year-old daughter, complex lymphovenous of the neck and tongue, encasement of carotid artery. She's had several scleral rounds, several laser
I
tongue.
can help. I can help. A big deal.
Okay, he can help. Again, Joanna, you can set up a virtual consult with him through his office, through his email that's on here, or you can come to our super clinic, or you can go directly to Italy. What is the risk of necrosis with MEST?
With the new device, it's almost close to zero. Actually, I haven't seen any necrosis yet
Okay, so
with
there you go.
electrosclerotherapy 2.0, the ePORE device.
Oh, this is a good one. Lacey Burke, we saw her son Harrison. He's 3. You diagnosed him with the nose and forehead AVM 2 years ago at the super clinic. Would you still consider him a surgical case or a mess case?
I need to see him again.
Okay, so
I
Lacey,
will see him in
come
October, I
on back.
suppose, and then we will decide
Yeah,
together.
he'll have, you can come back and see him. Okay, trying to get through these because we're already
In
15.
any case, if for all of you, if you go and write electrosclerotherapy on Google, I think the website I have created for this will pop out as second or third. So you can find the web page that I have built explicitly for patients, and it deals with electrosclerotherapy. It's
Okay.
on angioma.eu/electrosclerotherapy.
Quickly, well, for the port wine stain question, there's always changes with puberty. So, and no 2 port wines are alike. Some come back 3 weeks after a treatment. Some patients can go years without it. Everybody's timeline is different. And if they're talking about sirolimus for patients with port wine stain, I'm not happy about that. So.
I would love to be able to say it works, but until now I haven't seen so much benefit from sirolimus in port wine stains, unfortunately.
Again, that was another question that should answer that for you, Melissa. We're not, Dr. Geronimus and Dr. Nelson and Rox Anderson, who are the top laser experts in the world, are not big on topical sirolimus with pulse dye laser. They have not, because you can't tell unless you treat the exact circle and make a line down it and half with sirolimus and half not. We're just not sure if it's going to enhance the treatment or keep it from recurring. So that's why it's really not a standard of care in the US, though there's pockets of doctors. I don't know what your experience is with the topical being used with pulse dye.
We'll still have to find a molecule that really helps. We have tried so many, still haven't found one that really makes a difference.
Again, everybody, we really do have to wrap up. I know there's a lot more questions on here. A lot of your questions have been answered. I'm scrolling past the ones that we've already answered. This is going to shut off, and we have to let Dr. Colletti go to sleep because it's after 10 p.m. in Italy right now. And we normally only run these for 1 hour. This is literally our longest session since I started VBF Facebook Live on January 1st of 2017. So in 9 years, this has been our longest one, and rightfully so. And rightfully so. The right doctor, the right topic. Go back and listen through this whole thing. Almost every question has been answered. You can play this back as many times as you want. The genetic biopsies, you can contact a hematologist that is at a vascular anomalies clinic. So just Google vascular anomalies clinics, find a hematologist with one of those, and they can take care of that for you. I'm sorry, we've really got to wrap these up because I'm afraid it's going to shut down. My daughter's AVM has come back 3 times. She's had it surgically removed 4 times. She's 18. It's deep in her brain. Not there yet.
No,
Unfortunately, sorry
unfortunately.
about that. So Dr. Colletti, this is crazy. This has been like exactly what I thought. It was going to be a glow up, blow up. And you know how excited I've been about this these treatments, and right there by your side with every new development and sharing in the excitement. And I'm so proud to be your colleague. I'm so proud to be living at a time where you and I could work together to bring these treatments to these families. I mean, I didn't meet you 10 years ago because it wasn't the right time. I met you 8 years ago because it was the right time. And just like it says in the Old Testament with Esther, you know, you were born for such a time as this. And I believe that. I believe that me with VBF and you with your gifts and talents and genius, that we were born for a time like this.
I deserve that.
Well, I think collectively, Dr. Colletti and VBF and Dr. Linda we've really pushed the bar in the diagnosis and treatment of vascular anomalies. And that's a life well lived, you know, that we have been able to say that we've done this for people. And, you know, basically VBF, we don't get paid. We don't get paid either. So once again, if this was important for you and if you're excited, please birthmark.org/donate, because we can't keep doing this without donations, and we can't keep cutting our salaries and cutting out things that we want to offer to save money. We just need people to give back and pay it forward because of what you've been able to get, because there'll be a family tomorrow and there's a baby born today that's going to need these services. So please help us to keep going, keep up with our research. A lot of things down the pike for the future, genetic editing, all kinds of exciting things that I look forward to sharing with you and to collaborating with Dr. Colletti and all his amazing new developments. And I know you, Dr. Colletti, really well. And I know there's another one right up your sleeve. I know it right now that you've got another one. You didn't even tell me about this, but I know you got another surprise up your sleeve that's coming, right?
I do.
So there you go. Thank
No,
you.
me too well. Goodbye. Thank you
Thank
so
you
much.
all. Take care.
Bye bye.